Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we tackle the tough questions in musculoskeletal medicine. Today's topic is a particularly challenging one because spine care is so complex. There are so many variables that go into deciding if a back surgery is right for someone. And with chronic back pain affecting about 25% of adults, you can imagine that there are millions of adults trying to decide whether a back surgery is right for them. But is there another alternative, like spinal cord stimulation, that might be a better fit? Recent studies are helping clear this up. So let's get into it. Now, why is it so hard to decide whether or not to consider spine surgery? Well, to start, it's because the spine is just so intricate. It's really clear, for instance, when a patient has abdominal pain from appendicitis, when or if they need their appendix taken out. And barring some complication, once the surgeon takes out the appendix, the problem is fixed and it doesn't come back. That kind of surgery is pretty cut and dry. Spinal pain, however, is way more multifaceted. There are a lot of sources of pain in the spine. Pinched or compressed nerves, joints that are arthritic, discs that are herniated, discs that are just degenerated, muscles, tendons, ligaments that are not functioning properly. And then you have a whole other issue called central sensitization, where the nervous system gets oversensitized to a painful process. This can happen anywhere in the body, but is really prevalent in spinal pain. The nervous system actually changes so that it is in a state of hyperactivity, sending this inappropriate pain signal. And this central sensitization isn't necessarily fixed with surgery. Say you have an arthritic hip and you get hip replacement. The doctor basically replaces the arthritic surfaces with man-made parts. So while a person may still have pain from muscles or tendons down the road, in general, the joint itself can't be painful because it's man-made and it's therefore not connected to the nervous system. Now, of course, there are still painful nerve issues that could happen, but relatively rare. This kind of surgery has a more predictable outcome. But with the spine, the surgeon is not taking out your spine and putting in a new one. We aren't there in medicine, guys. Most typically, spine surgery is addressing compressed nerves or spinal instability, removing disc or bone that is compressing nerves and fusing spinal segments to prevent motion that then further compresses nerves or causes pain. Some things are clear no-brainers for spine surgery. If there is compression of nerves or spinal cord causing weakness, it's most likely that person needs surgery. Classically, this would be a person who can't walk very far without their legs feeling numb and weak. Maybe this person has foot drop and is tripping over their toes. Another classic scenario would be a person who has sciatica pain from a pinched nerve that has not responded to conservative care. That would typically be a clear-cut indication for spinal surgery. But there are many patients who aren't good candidates for spine surgery for a variety of reasons. Other health conditions and advanced age, that's what patients most commonly are concerned about. But there is another really common reason. Sometimes the spine is just too badly degenerated. Unfortunately, for a lot of patients, their spine pathology is pretty diffuse, meaning it's not one disc or one level that's in need of repair. In these cases, if the surgeon tried to fix one level, even if they think that's the really problematic area, the levels above that and below that might not be able to take the pressure. So when you do spine surgery, you change the mechanics of the back. That is particularly true with spinal fusion, which will put some extra pressure on the levels surrounding that fused level. So if the other levels are severely degenerated to begin with, they may not be able to support that fused level, and sometimes will unfortunately deteriorate faster. This is what you might have heard about when someone says that they had a back surgery and then maybe they had to have another or maybe another. Okay, now let's add another level of complexity. Not all MRI or X-ray findings are actually symptomatic. In fact, most aren't. Almost all of us over 40 have degenerated disc and joint arthritis, even if we don't have any symptoms. See, most spine pathology happens slowly, and our amazing bodies just adjust to those changes. Unfortunately, however, sometimes a more acute change happens or spinal stenosis becomes so significant that the body just can't accommodate anymore. So when a 70-year-old comes in with new pain and the doctor says, well, it's from spinal stenosis, etc., these findings often aren't new at all. The pain or the spinal dysfunction, now that might be new, but the MRI findings are very likely the same before as they were after the pain developed. So your surgeon has so much to consider. And one more thing that we have to think about, going back to that concept of a joint replacement. Nowadays, joint replacements last a very long time. Now, 20 plus years ago, we might have told a person that their joint replacement might last a decade or something like that, but that's not the case now. But what about the spine? Now, that hardware is going to last forever. But remember, the surgeon isn't taking out your spine and putting in a new one. He's correcting a specific problem. But as long as you still have birthdays, the structures around that are going to continue to age and wear out. So spine surgery, unfortunately, is not a one and done proposition for a lot of patients. So this is what I probably say 10 times a day. Spine surgery is fabulous at fixing what it can fix. It takes pressure off compressed nerves, it stabilizes the spine, and it corrects or prevents progression of curvatures. It is truly life-changing for many and is absolutely necessary for a lot of my patients. What spine surgery is not great at treating is low back pain. So while pain may be the reason that people show up into the surgeon's office, pain is not ultimately what the surgeon is fixing. He's fixing an anatomical problem that is causing some dysfunction, but we already said that spinal pain is way more complex than just MRI findings. Now, we live here in a shipbuilding and military town, and most of my patients are pretty analytical, and they're kind of mechanical thinking people. And when I have this conversation, they look at me and say, Doctor, there is a problem. Get a tool, go in there and fix it, right? Kind of like fixing a car. But unfortunately, spinal care isn't like that. So what do you do if you don't have a problem that's fixable? Or what if you've had back surgery and you still have pain? Well, recent studies have shown that spinal cord stimulation can be effective for patients with back pain who never have had back surgery. Now, first, let me explain a little bit about neuromodulation. In spinal cord stimulation, an electrical lead is placed into the epidural space. This is a space of fat and blood vessels inside the spinal bony canal, but outside of the sac that contains the spinal cord. This space is where patients may get epidural injections for pain, and it's also the space where anesthesiologists will place medicine for surgeries or labor and delivery. The spinal cord stimulator electrical lead sends an impulse which kind of disrupts the pain signal. It doesn't cause the person to feel numb, but it just disrupts the inappropriate pain signal. Now, this is not new, and it's been used for decades. However, in the last 20 years, the technology has continued to improve significantly with the addition of high-frequency and closed-loop systems. It's done initially as a temporary trial of up to a week to see if a patient gets relief, and then a long-term system is put in. We know spinal cord stimulation works for people who have something called failed back surgery syndrome. This is when spinal pain persists after correction of the anatomical problem surgically. The more complex the surgery, the more likely this was to occur. And we know that revision surgeries unfortunately do have a lower success rate than initial spine surgeries. Now, there are a lot of reasons for this to happen, and that could be a whole other podcast itself. But remember when I said earlier that spine surgery is good at what it's good at. It fixes a specific problem. Once that problem is fixed, the specific issue like leg weakness should improve. The patient may still have pain, typically less pain than they had before. And now their legs aren't weak, so that's all great. So the surgery is usually a success in that respect. But what if the person still has a lot of pain? Well, for years we've known that spinal cord stimulation works well and is more often successful than reoperation. But this is for pain, okay? When a patient comes to me and has developed another level of stenosis above or around a fusion surgery and now has leg weakness, I'm going to suggest surgery, not spinal cord stimulation. But for the pain itself, spinal cord stimulation is more effective. Now, let's go back to those patients who have had surgery. Who have not had surgery. They aren't a good candidate for spine surgery for a myriad of reasons that we talked about. So what about them? Well, multiple conservative management options exist. physical therapy, medicine, spine injections. But for a lot of patients, they're going to become less responsive to this over time. Studies have shown that spinal cord stimulation is the first-line surgical treatment or in patients with chronic back pain that has been difficult to manage by conservative management. A recent study shows patients who got conventional management plus spinal cord stimulation have less pain, disability, and better quality of life compared to those who got conventional management alone. Okay, so if your head is spinning from all of this, I get it. It's complex, which is why I'm here. But what are the take-homes? How should a patient approach this decision? Well, we're unique here at OSC in that the pain physicians and spine surgeons co-treat, and we'll get you to the right doctor at the right time. But in general, how I would approach this decision is first, is there a problem that must be fixed because a person has a neurological injury, for instance? In that case, you need to see the surgeon. No-brainer, okay? But if that's not the case, then does the person have a problem that is amenable to being fixed? So basically, can the surgeon fix it? And is the surgery likely to be a success and not lead to other problems? If the answer is yes, again, surgery is probably the right answer. If the answer to those questions, though, isn't clearly yes, then surgery may very well not be the right answer. If conventional management isn't working, spinal cord stimulation may be a better option. I would suggest for my patients that they talk with me and they talk with their surgeon. Really, you need to be upfront with what your expectations from surgery are and what you would consider a success. Your surgeon and your pain doctor should be frank with you about what we can and can't achieve with these procedures so you can decide what works best for you. So the take-home point here really is that spinal cord stimulation or spine surgery depends on the right patient at the right time. And even though the studies do give us some guidance as to which patients are best for which situation, it ultimately comes down to what you as the patient need and what your expectations are for pain relief. Thank you for listening today. Please rate and subscribe. If there's questions you want to answer, let us know. Wishing you good health and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.